Okay. Good morning, everybody. I'm Diana Williams from the K&W Group, and I'm happy to be here to talk to everybody about the 2019 annual open enrollment. When we take a look at this time of year, it's your one time of year to go through the plan change or go through the plan and really look at things. So we want to remind you as Multi-Tech goes through open enrollment that we really spend the time each year to look at your total rewards package. So the goal is to offer you guys a competitive, affordable benefits package. With the information that we present this year, we were able to negotiate a favorable medical renewal, so you won't see a lot of changes, and the rest of the benefits are pretty much remaining the same. So fairly good news. So with that, we really want to help you and your family provide benefits that help you enjoy a healthy well-being. Providing meaningful benefits has been very important to Multi-Tech and the leadership team, and watching the benefits and making sure that they are comprehensive in nature as well. So as we talk about open enrollment, we will look at the period of November 8th through November 19th for making benefit choices. Open enrollment is that one time of year where you can elect or decline coverage. You can add dependents or drop dependents. Your coverage elections will be in effect from January 1st, 2019 through December 31st. The annual enrollment period will end on November 19th, so that is the date. We encourage everybody to get out there before that date to really take a look at all of their elections. This year we will be talking about an online enrollment process, and we will run through that at the end of the meeting. The only other time you can make changes to your elections outside of open enrollment is if you have an event such as marriage, birth, loss of coverage through another source. If you have those types of situations, you can notify HR within 30 days of the event, and you will be allowed to make coverage. And just a reminder, with the medical plan through Multi-Tech, if your spouse does have other coverage through their employer, they are not eligible for the medical coverage under Multi-Tech. So this year for enrollment, employees will go to the EMS website to enroll online. And we will walk you through step by step how that website works at the end of the presentation. We will continue to have two medical plans. Last year, we rolled out a high deductible medical plan. When we look at these plans, you'll see that there are a few changes in the plan design on the PPO plan. The high deductible stayed relatively the same. There are a few changes in contributions, but overall, nothing that's too significant for you. When you look at the dental plan, there'll be no changes there. For the HSA, we'll talk about the contribution limits, and for the FSA, we'll discuss how that works as well. So during open enrollment, this is your time to pick the best medical plan for you and your family. We'll walk you through how you make those choices. We'll talk about the dental and the vision. We'll review the flexible spending account and how you can use that to save money in taxes. And we'll talk about the life and the disability. So remember, when you look at the benefits offered by Multi-Tech, those are important pieces to your financial plan. If you meet with a financial planner, one of the first pieces that they'll ask you is, do you have insurance? Do you have medical insurance? Do you have life insurance? Do you have disability insurance? So with your plan at Multi-Tech, you get to answer yes to all those questions. You have a comprehensive medical plan, you have life plan, and you have disability insurance available to you. So those are all great benefits that we'll touch on today. We'll start with the medical plan. Multi-Tech has Blue Cross Blue Shield, and we use the Aware and the Blue Card network. When you're traveling, you have access to the most extensive network in the United States as well as internationally. So just a quick reminder that if you are planning a trip outside of the United States, give Blue Cross Blue Shield a call ahead of time and let them know. They'll get you set up with a global network that gives you access to care internationally. We're going to spend a little bit of time talking about preventive care. When you're looking at the health insurance plan, preventive care is covered at 100%, regardless of the plan that you choose. And that's one area as far as Multi-Tech and our population goes that we can have some improvement. We have a number of individuals who haven't had the required preventive screenings. So when we talk through this slide, we just want to let you know what should be covered at 100%. If you look at the statistics with Blue Cross Blue Shield, you'd see that 28% of individuals haven't had the required preventive exam. and a lot of the preventive exam claims have been paid incorrectly. So we want you to get the best benefits. We want you to go in and have your preventive exam. So with that, we're reminding you, when you go in, you should expect that your full annual exam and testing are covered at 100%. Your well child visits are covered at 100%, as well as vaccines like flu shots, prenatal and postnatal care, and your cancer screenings, breast cancer, cervical, and colon cancer screenings. So those should all be covered at 100%. When you're in the doctor's office, you do have the right to ask them to give you a summary of the services that were performed on the day of your visit. So we would encourage you to run through that summary while you're at the doctor's office. That summary isn't going to give you costs, but it will tell you the services that were performed. When you look at the services that were performed, if they're all saying preventive, then you know you'll get 100% coverage for those services. If you see some services that are related to a condition or a diagnosis, such as they looked at you for a sinus infection, or they looked at something to do with your leg or your arm or knee, something like that, those services then would be subject to either a copay or deductible. So when you're seeing those kinds of services, just know you could have some payment. And that's fine. We would encourage you, if you haven't been to the doctor a while and you have things going on, that is the time to ask those questions. But just realize then you may not get 100% coverage for those things. When you look at the plans, there's a few things you're going to want to think about. We'll talk today about premium contributions, which is the amount that you pay for coverage. We'll talk about your deductible. That's the amount you pay upfront for services. We'll talk about the co-payments that you pay for certain services. Co-insurance, that is the amount you pay after your deductible is met. And then we'll talk a lot about out-of-pocket maximum. That's really the most you'll ever pay for services. Once you hit out-of-pocket maximum, you have 100% coverage. Probably the biggest consideration as you look at the two plans Multi-Tech offers is the pharmacy benefit. The pharmacy benefit works differently under each plan. One thing to remember under the HSA plan is you do pay 100% coverage for pharmacy unless your medication is on the preventive drug list. So we'll talk a little bit about that. And with the PPO plan, you do have copays. So as people make decisions, that's probably one of the biggest factors to consider is how much do you spend on pharmacy costs during the year. When you look at the two plan designs, this information is in the benefit guide with the Multi-Tech logo on it. You'll be able to find this easily in that open enrollment benefit guide. The benefit guide shows both medical plans. So it shows the $1,000 deductible copay plan and the $3,000 high deductible plan. When you compare those two plans, the first thing you'll notice is the deductibles are different. So with the $1,000 deductible plan, it's $1,000 per person. With the high deductible plan, it's $3,000 per person. And just a quick note on how our deductibles and our out-of-pocket maximum work. Our plans are what's called embedded. So that means that if you take family coverage, each person in your family is only subject to one deductible, that employee-only deductible. So if I take family coverage and I take a $1,000 deductible plan, something happens to me, I would pay $1,000. If something happens to my spouse, they would pay $1,000, then we would have met that overall deductible. So when you're comparing the deductibles on the two plans, you'll see, and what some people notice right away, is the high deductible health plan for family has a higher deductible. It does, but your likelihood of hitting that deductible probably isn't great. I would tell you most people in family, only one person uses a significant amount of medical care. So with that, if it was just you and your spouse and you both hit the deductible, you'd pay $6,000 on that plan. When you compare these two plans, you'll also notice the difference in the out-of-pocket maximum. We like to call this out. Multi-Tech was careful to really look at plans that help offer you financial protection. So when you look at the out-of-pocket maximum, the out-of-pocket maximum for the high deductible health plan is actually lower than the out-of-pocket maximum for the copay plan. And we want to make sure that if something bad happens, you still have very comprehensive coverage. So when you look at this plan, if you were to have a major hospital claim and you were on the high deductible health plan, the most you'd pay out is $3,000 if it happened to you. And you would get a contribution to a health savings account to help you pay that amount. So it is a very positive plan, and it's something to consider and put pencil to paper as you evaluate the options. The other thing that you need to understand is how it works after you meet your deductible. So with the $1,000 deductible plan, you're going to pay your deductible, and then after you meet your deductible, you're going to pay 15% of the costs that come into the door. On the high deductible health plan, you pay the deductible, then you have 100% coverage. So it works a little bit different. Preventive care is covered at 100% on both plans, so that's a good thing. Any of those preventive visits, you get 100% coverage for. And then you look at the rest of the services. So essentially on the copay plan, you have copays for retail or online care. You have copays when you go to the doctor's office. You have copays when you go to the ER and urgent care. And then you have copays at the pharmacy. If you look at the high deductible health plan, you're going to see that all charges, with the exception of preventive care, go towards that deductible. So if you're taking something that's preventive in nature, you'll see that that is something that would be covered as of the 100%. So if it's a preventive pharmacy, that type of thing is going to be covered at 100%. With that, I would encourage you to really look at that preventive drug list and make sure that the amount that you're paying or the prescription that you're taking is covered under that list. There's lots of medications in the area of high blood pressure, high cholesterol, that type of thing. So that is really, when you're comparing the plans, make sure that you look to see, are you getting the most out of your money? If you're on the copay plan and you have lots of doctor's office visits and lots of medications, so you're taking medications at maybe $300 a month and you're getting those for a $50 copay, then you're getting a lot of value being on that copay plan. If you're on a lot of generic medications and you're going to the doctor just a few times a year, then you're probably better off on the high deductible plan. The next thing you want to consider is your contributions. How much do you pay for the plan? So when you take a look at these contributions, they are up slightly from last year. You'll see as you compare them, there is a pretty substantial difference between each of the plans. So you're going to want to take a look at what coverage you have, if you cover yourself plus one person, or your full family. And then you're really going to want to look at both of the plans and understand how that coverage works. I always encourage people to look at it on an annual basis. So if you take those premiums and multiply them by 12, you can see the annual difference for each of those plans. So if you're single and you take the high deductible health plan, you'd pay $652 less than you would if you were on the $1,000 deductible plan. And for families, there's almost a $2,000 difference. The other thing that you need to consider when you're evaluating the plans is the fact that multi-tech will give you money into the HSA to help you pay for your deductible. So if you're single, you will get $400 put into your HSA, and that goes in on a quarterly basis. If you're single plus one, you'd get $800, and family, you'd get $1,200. So if you really look at those two things together, if you're a single person and you tip the high deductible health plan, you'd get $652 in premium savings. So we would always encourage you to take that money and use that to fund your HSA, that premium savings. And then you get another $400 from multi-tech. So if you took that premium savings of $652 plus the $400 in savings, you'd be able to fund your HSA $1,052. And that's less than most people spend a year in healthcare. When we look at utilization, most of the folks at multi-tech spend less than $750 a year on healthcare. So the plan works very well. But when you look at it, selecting the right plan can be confusing. So we would encourage you to really go out to the Blue Cross Blue Shield website, take a look at what your healthcare costs were over the last year, and see if you think your healthcare costs will be similar this year, and really weigh your choices when you make your decisions. If you need more assistance in making decisions, please reach out to the HR team and we can get you some assistance to sit down and review and evaluate the plan. The next thing we'll talk about is the health savings account itself. So if you take the high deductible health plan, you will have access to the health savings account. The health savings account allows you to set aside money on a pre-tax basis to pay for medical, dental, and vision expenses. Multi-tech puts money into the HSA for you, and that also goes in on a pre-tax basis. And then you will have the opportunity to invest. I know last year when we first rolled out the HSA, most people just went into the standard account. There's no charge for you if you go into the standard health savings account. This year, you may want to explore opportunities to start investing. So if you do go out to the Hello Further website, there are opportunities for you to look at other accounts that allow you to invest in mutual funds. You can look and compare how those funds rank. There's fund families similar to what you'd see on your 401k plan. HSA funds can be used to pay for your own medical expenses, your spouse's medical expenses, or legal dependents that are your tax dependents. So if you have a child who is going to school full-time, they would be eligible to be reimbursed out of your HSA. They don't have to be covered under the medical plan. So if you take the medical plan here at Multi-Tech and your spouse has another medical plan, you can use your HSA money to pay for their expenses. The HSA funds are yours to keep, and it is portable. So one thing I always like to remind people that it is a health savings account, not a health spending account. So remember, you don't have to rush to use it like you would a flexible spending account. You can carry that money over from year to year. So try to pay for expenses out of your pocket when possible. If you pay for those expenses out of your pocket, save the receipts, and then you have those as backup. So if over the course of 3 or 4 years, you accumulate $2,000 worth of receipts, you have the ability to take $2,000 out of the HSA at any time because you have that documentation to back it up. With the health savings account, the money must be in your account to receive reimbursement. So if you're just starting the HSA for the first time, you're going to just have that quarterly funding that goes in by Multi-Tech and any amount you put in per paycheck. You can change your HSA amounts at any time, so you are able to increase or decrease your amount. So we always encourage you to think about things. If you start out the year and you don't put much in and you have some medical expenses, you can come into HR and increase that or decrease that amount at any time. And really understand your qualified expenses, medical, dental, vision expenses. We do also allow on the HSA for premiums to run through there. So if you need an individual medical plan, like a COBRA plan, or maybe you want to retire a little bit early and buy an individual medical plan, you can use your HSA money for that. Always keep your receipts and always keep your plan information. If you're ever audited, the IRS would see your receipts, and they'd also want to see that you were on a high deductible health plan. The Hello Further has some great information on that website for you. The HSA, remember, to be eligible for the HSA, you must be on a high deductible health plan, and make sure that you are not enrolled in any other health insurance plan, whether that be a Medicare plan. If you're over age 65, you can't be enrolled in Medicare Part A, B, or a supplement and put money into a health savings account. You can't be covered by another health care plan that's not a high deductible health plan, and you can't be claimed on someone else as a dependent on someone else's tax return. And probably the biggest thing people run into is the flexible spending account. So if you take the health savings account here at Multi-Tech, you cannot have your spouse take a flexible spending account because the IRS is fearful that you would double dip, take money out of your health savings account and their flexible spending account. So your spouse cannot have a traditional flexible spending account if you're putting money into an HSA. And you can't be covered by TRICARE. So when you look at the health savings account, the limits did increase this year. Multi-Tech will continue to make their contribution on a quarterly basis. With that limit, it went to $3,500 for an individual and $7,000 for a family. So if you look at the maximum that you could put in after Multi-Tech contribution, it would be $3,100 for single, $6,200 for a single plus one, and $5,800 for a full family. Remember that you can do a $1,000 catch-up contribution in the HSA if you are 55 years or older. So we would encourage you really to take the time, go out to the Further website, look at your balances, look at your options, see if you would like to invest, things like that. It's a good time of year to consider those options. When you're looking at the Multi-Tech medical plan, some of you will be evaluating this plan against other plans, such as a spouse's employer. So really look at the deductible and the out-of-pocket maximum. When you look at this slide, it's showing you Multi-Tech's plan in comparison to other employers' plans. So what you'll notice is Multi-Tech does have deductibles that tend to be a little bit lower than others, as well as out-of-pocket maximum. So when you look at those examine them carefully, look at what the single deductibles are, understand if you're taking family coverage, does it have that embedded per person limit on the other plan? And then also look at the premiums that you would pay for coverage. When you look at family medical coverage, Multi-Tech does offer a good value for family medical coverage for those who need it. And just a reminder that if your spouse does have access to other health insurance coverage, they are not allowed coverage under Multi-Tech plans. So you should take a look at that each year as well. Resources for Blue Cross Blue Shield. If anyone has been out in the last few weeks on that Blue Cross Blue Shield website, you've noticed that there is a new member experience. With the website, it has been redesigned to look more like a banking website. So it should be a little bit more intuitive. When you go out there, you'll be able to see your balance information, which would be your deductible, how much you paid in towards deductible and out of pocket. It also shows you any important messages or reminders about your claims. And it'll also show you your flexible spending or HSA balance. So that's all right at the top available to you. On the bottom of the screen, you'll see the detail, the weekly claims that have come through. So you can see each of your medical claims. What will be available coming in 2019 will be a new Blue Cross Blue Shield app. This is going to work really well. The current website is just a mobile-enabled website and does not work well from your phone. So we will be getting information out in early 2019 about the new Blue Cross Blue Shield app, and that app will allow you to look at all your medical claims. The nice thing about that app is it will also hold your ID card. So when you go to the doctor, you just pull up the app and you can show them your ID card. It will also give you helpful recommendations. If you take medications and you're using this app and you fill a prescription, it will tell you if there's something less expensive available for you. It will also give you helpful reminders. If you haven't had your preventive exam, you'll receive reminders on those types of things. So great app to help you manage your health. The other thing we're asking is that you really know where to go to get care ahead of time. So before something happens, understand your options. Know that you have access to Doctor on Demand. That is the lowest place cost to get care and probably the most convenient way to get care. So we'll talk about that. Convenience care are those clinics that are located in retail stores like Target, CVS, Hy-Vee, things like that. Office visits, those are the things that you go to the primary care physician for. So those are all very cost-effective ways to get care. When you hit after-hours clinics or emergency rooms, those are going to be the more expensive places to go to get care. So always understand your options and know where to go. One of the services that we've talked about over the last few years is Doctor on Demand. Doctor on Demand is proven to be a really good resource for individuals. It's a 24/7 access to a physician that can diagnose and treat medical conditions over the phone. So if you call in and ask the doctor and have a video visit, they will prescribe medications over the phone. Think of this service for things like pink eye, sinus infections, ear infections. They treat things such as asthma, acne, other dermatology conditions like skin infections, things like that, bug bites. So remember, we have that available. If you are on the copay plan, it's a $5 copay. If you're on the high deductible plan, you would pay the cost of the service. Average visit for a Doctor on Demand is about $49, so significantly less than what you would pay if you were going into a physician's office. Doctor on Demand does now treat behavioral health or mental health conditions as well. Those would be a little bit higher cost, but it is a good resource to be able to get in and talk to someone right away about those types of issues. Pharmacy benefits, making the most of your pharmacy benefits. Again, when we download the new app, it's going to help you find medications, find pharmacies that are the lowest cost. So that will be a good benefit for you. If you go out to the website right now, you can do the same thing by searching your drugs and searching your pharmacy to find the lowest cost. Dental benefits, as we take a look at the dental plan will not be changing. Everything will stay the same. If you look at the plan design itself, we do have a $1,500 annual calendar maximum. So the plan does allow $1,500 a year in dental benefits. If you do see a Delta PPO provider, you will get the highest level of benefits because you get discounts. So when you take a look at this slide, it's showing you the Delta PPO network, the Delta Premier network, and not participating. That means they're not in any network. You'll see that the benefits are the same across the board for all three plans. The difference really is just the discount. So if you see a Delta PPO dentist, they give you about a 20% discount off of what you would have to pay. A Delta Premier discount would give you about 5%. And if you go out of the network, you're not going to get any discount at all. And it's perfectly fine. On dental, it's different than medical. With medical, we always tell you to go in network, and most of you do. With dental, if your dentist isn't in the network, we still have that same level of coverage. You're just not going to get those discounts. We do have coverage out for oral surgery. I get a lot of questions right now on dentures, bridges, things like that. So you can see those coverages are out there for you. And then also the calendar year deductible of $50 is only going to apply to those basic and major services. When you go to the Delta Dental website, you'll see information from Delta Dental. You'll be able to search your network, look at resources, get cost estimates for dental procedures, things like that. So great website for you. Life and disability, Multi-Tech has a great life and disability plan, and as we talked about, a great piece of your financial plan. So just know that our life insurance, our short-term disability, and our voluntary life insurance will stay the same. You won't see that information out on the enrollment site, but there are no changes to that benefit. Voluntary life, if you're enrolled in the voluntary life insurance program, that will roll over for you as well. Just know that if you do have an age change, like going from 34 to 35, you may see that your rate goes up in January. And always update your beneficiary designation. If you have any changes, let HR know, and they will update your beneficiary for you. Flexible spending accounts are for those people who join the copay plan. If you're going to stay in the $1,000 copay plan, then you would use a flexible spending account. The flexible spending account allows you to set aside up to $2,650 per year for medical, dental, and vision expenses that wouldn't be covered by insurance, so those things that you pay out of your pocket. The limited purpose flexible spending account is for people who are on the high deductible health plan and would like to run dental and vision expenses through this account. I would tell you that not many people use a limited purpose account. Most people would just use their health savings account, because your health savings account will let you pay for dental and vision. The only people who would use the limited purpose account are people who are trying to save their health savings account for medical only expenses. Then they may want to just run their dental and vision through the limited purpose. But most people would just put the money in their HSA. Daycare is available to all employees. You can set aside up to $5,000 for daycare. You don't have to be on the medical plan to take the daycare account. Again, remember, on the full medical account, that is available for deductibles, coinsurance, dental work, and eyeglasses, contact lenses. With this account, it is a use it or lose it account, so any money you put in there you have to use, with the exception of $500. We do allow you to roll over $500 from year to year. You do have to enroll in the flexible spending account every year. 401k, Multi-Tech offers a great 401k plan, free money, match on investments, and with this, the money comes out before taxes again. So powerful savings tool. With this account, Multi-Tech will continue their match of 4% for participants contributing 6% or more. So you can see the vesting or the contribution schedule on the screen. We always encourage you to go above and beyond 6% if you can. The new maximum for 2019 is $19,000. That's what you'd be able to put away. And then the employee catch-up contribution for those who are 50 or older would be $6,000 for 2019. There is a 5-year vesting schedule on the employer contribution. So I'm going to turn it over to Katie, and she's going to talk to you about what you need to do for open enrollment.
All right. So I will quick change the screen to show our new online enrollment, just to kind of walk you through. If you're uncomfortable, just since it's a new thing this year, so just bear with us for 1 second. All right, so this is that online CBiz account. This is where you should be used to going on and viewing your pay stubs. You can change your taxes, direct deposit information. And now for 2019, you can make benefit changes, including open enrollment. So the reason why we decided to do online enrollment is just one of our initiatives for 2018. You know, we're a lean process improvement company. And so this was a process of ours that wasn't very lean. It was very repetitive. Anytime we have changes or open enrollment, you turn in a paper form. We have to enter that in every single benefit system, as well as payroll. So as you can imagine, that room for errors or just entry errors, administrative errors is just a lot greater that way. Also, just with paper forms, I mean, your social security numbers are on there, your dependents' personal information's on there. I mean, just naturally, it's just not as secure. So this flows not only from here to our payroll system, so all of your deductions, just whatever you elect in, just automatically flow over to our payroll system, but they also flow to all the benefit carriers. So again, not having to make a bunch of duplicate entries where there's just that increased room for error. It's all seamless and just therefore more secure. So I won't spend a lot of time, but I'll just go through this on a very quick demo. The step-by-step instructions are in those packets that you either came down to the front desk to receive. If you're a remote employee, we did mail those out earlier this week, so you should be getting that. But I'll also show you where the step-by-step instructions are within this account too. So starting today, you will see this event or change of event screen, and it'll be a drop down to open enrollment. I'm on a person called Sally Sample. So you will click begin event. And then it'll pop up to this screen called instructions, just very basic. You can just review and click continue. The acceptance has just our little acceptance kind of, you need to confirm, just stating that you're making these changes for open enrollment. They will stay unless you experience a life event in 2019. And then the spousal affidavit just stating you can't cover your spouse if he or she has coverage through their employer. You can hit accept and wish to continue. Open enrollment, this is just a good time to review your personal information. So if your address changed, you want to update your email, you want to update your marriage status, you can click edit and it'll bring you to the screen to ride over and make any of those changes. If you don't want to make any changes, then you would just click save and continue, and then all the changes look good. It will bring you to the next screen, which is your dependent information. So we tested this out on a couple new hires this year and a couple people who had status changes throughout the year. And one question that came up is, oh, my spouse is on here, but they're not a dependent. Well, in the benefit world, a dependent is anyone that you carry or is eligible to be on our plan. It doesn't mean, like a true dependent, like a child. So in here is already going to be pre-populated with your current dependent elections, social security numbers, genders, and date of birth, and relationships. So if you need to add someone to the plan this year, then you would just click add dependent, fill in all the required fields, click save information, and then you would see them listed at that underneath in that dependent area. So you can click save and continue. And then the benefits tab is all of our benefits. So I'll just kind of say one little thing is that we do not have our 401k information to elect online here. That's just a Fidelity thing. They only want elections and deferral elections for 401k to be made directly with Fidelity, which is very common with 401k providers. And then Sun Life, you can change your Sun Life elections at any time throughout the year. It's not an open enrollment event. So there is still a paper form for that. That is a process that we will be streamlining and putting online for 2019. So 2018, we decided just to do the main big benefits. So the first one will be medical, and you can select either the $1,000 copay plan or the high deductible health plan, or you can waive coverage. So one thing you'll notice is if you didn't list any dependents, the only coverage option that will be available to you will be employee only. If you only listed one dependent, like we did with Sally Sample, you will only be able to elect employee plus one. And so if you're ever like, oh, I want to have family coverage, but I don't have that available, go back to your dependent screen, add those people. And then whatever you select, you just will need to check the dependents that you want covered under that plan down here. Then you can click save and continue. Dental, same thing. I'm just going to not cover Sammy, so I won't select her. And then the HSA plan. So it is smart enough that if you selected the PPO plan, it would just say you're ineligible to contribute to this, and you'd hit save and continue. But because we did the HSA plan, I'm going to say I want to contribute $2,000. If you click this calculator, it will show you how much comes out per paycheck. It shows you how many paychecks we have that year. So $2,000 will be $76.92 out of a paycheck. Save and continue, FSA account. This is also for the limited one. So if you want to do the limited health savings account, if you're on the HSA plan, you can do that under this area. And then last but not least, dependent care, same thing if you want to contribute or if you don't want to contribute. And then over here is kind of your little online shopping cart. This is the total amount you will see out of your paycheck starting in 2019. The next tab is just emergency contacts, just a good time of year to update that information. General information is just that one last reminder that this isn't all-inclusive to all multi-tax sponsored benefit plans. And then you can review. Down here is this documentation. This is all the digital, or I guess PDF to all of that information that's in your packet. So if you like paper form, you have the packet. If you like things more digital, you can get it here. And then it's just a review of all of your changes or elections that you will have for 2019. And then you can click save and confirm, and the one last confirm, save and confirm right there. And then what will happen is all this information will be given to me and Mackenzie to approve or deny. Once you get the approval, you'll get an email, and it will show you a benefits confirmation statement. So just to see what that is, if you look on your little 3 bars here, there's a benefits statement tab. So there's a total benefit statement and then just your benefit statement. So for Sally's sample, the benefit statements for 2019 elections will pop up. And let me just make this look better. It just kind of reviews everything she selected. Don't pay attention to this voluntary stuff because she's a sample. It'll show everything she selected for 2019, how much contributions to those health savings accounts or flex accounts, and then cover dependents. So that's kind of a nice thing for you to print off. So that is everything that we have. I will unmute everyone. So if you have any questions, feel free to either ask, or you can always give a call to me and Mackenzie, and we will help you out if you just want to talk one-on-one with us. KNW Group is here all day today, so if you do want to come, if you're here on site, you can come down. We're in the space behind the reception area, or if you're remote, just shoot me an email. We can set up a time. Otherwise, open enrollment goes until Monday the 19th, so you have that event will be there now until that. So, yeah, if everything else, if no questions, then thanks for attending.